you on our online seminar series with top international researchers. With today's topic, Best Practices Guide for Conducting and Reporting Systematic Reviews and Meta-Analyses. My name is Yudith Annisa, and I'm your host for today's program. It is our privilege to have you with us today. We appreciate you are taking a time off from your busy schedule for joining us. We hope you will find the program we have lined up for you to be fruitful and engaging. We would like to welcome also our remarkable speakers, Dr. Muhammad Miftahussurur, a senior researcher for Airlangga University, and Professor Wei-Chih Liao, an expertise from Faculty of Medicine, National Taiwan University. Thank you for your time. It's been an honor for us. Ladies and gentlemen, first of all, I would like to introduce you to our agenda today. We have three sessions. The first session is lecture that will be delivered by Dr. Muhammad Miftahussurur, followed by second session, which is a lecture that will be delivered by Professor Liao, and the last session is a forum for question and discussion. All participants can send questions to the speaker through our chat room, whether in the Zoom room or on live streaming on our YouTube channel. Entering our first session that will be delivered by Dr. Miftahussurur, I would like to introduce our first speaker here to all of the participants by showing and reading his brief CV and background. Here we have Dr. Muhammad Miftahussurur, specialist in internal medicine, also a PhD in internal medicine specialist. His position title right now is he is an internal medicine specialist in Division of Gastroenterology in Dr. Sutomo Hospital, Faculty of Medicine, Airlangga University, Surabaya, Indonesia. He also a chairman of Pylori and Microbiota Study Group, Institute of Tropical Disease, University of Airlangga. He also a senior research in Department of Environment and Preventive Medicine, Faculty of Medicine, Oita University, Japan, a chairman of Center of Journal Development and Scientific Publication, and also Vice President of University Airlangga for Internationalization, Digitalization, and Information. He has 65 publications with an H index of 15. And his achievement awards as follow: the most scientific publication in Airlangga University for Scopus Q1, the best lecture citation in Airlangga University. He has also has a poster award in the 26th annual meeting of Korean College of Helicobacter pylori and Upper Gastrointestinal Research Poster Oral Presentation, and the most productive lecturer at Airlangga University for publication in Scopus, and also having an award as a distinction poster in Digestive Disease Week 2005 in Washington, D.C. So, without any further hesitation, for the first session with the title Starting a Systematic Review for Beginning, Time and Place is your Dr. Miftahussurur.
Okay. Thank you very much. Thank you for time given. First, I would like to greet Professor Liao from National Taiwan University. We know recently National Taiwan University is made a list 100 best university in the world that I know. So we are lucky we have a speaker from one of the best university in the world. And thank you for your willingness to take the time to be a speaker in this event. As I discussed previously, Professor Liao, please excuse and give me permission to deliver my lecture in Indonesian language to based on the basic knowledge I think is important, so we can deliver to participants without bias, and maybe later we can discuss together with all audience in English. Thank you very much. So today I will continue with how starting a systemic review for beginner. I think it is clear picture, Dr. Yudith. Okay.
Yes, we can see it clearly.
Okay. So how starting a systemic review for beginner? Saya tadi meminta izin kepada Profesor Liao untuk bicara bahasa Indonesia, karena saya tahu bahwa mungkin ada beberapa teman-teman yang membutuhkan sebuah penjelasan yang lebih fleksibel, yang saya tidak ingin dibatasi dengan bahasa Inggris ya. Mungkin kalau nanti ada beberapa istilah bahasa Inggris ya tentunya akan saya sampaikan. Dan nanti ketika kita diskusi, mungkin kita akan kembali lagi dalam bahasa Inggris. Oke. Yang pertama saya ingin menyampaikan bahwa saya sendiri mencoba menulis review itu belum terlalu lama ya, Kira-kira sekitar 3 atau 4 tahun yang lalu saya menulis review, dan waktu itu saya mendapatkan bekal karena saya waktu menyelesaikan program spesialis saya harus menyelesaikan berbagai tugas ya, termasuk di situ adanya tinjauan pustaka atau referat bahasanya. Tetapi yang jadi masalah adalah ketika saya mempraktekkan ilmu yang saya dapat waktu saya spesialis ternyata tidak cukup untuk saya gunakan dasar-dasar tersebut untuk saya pakai. Sehingga saya berusaha untuk hari ini mencoba berbagi, bukan berarti apa yang kita pelajari sebelumnya keliru, tidak, tetapi ada beberapa standar-standar lain yang harus difahami. Ya. Jadi apa itu review paper? Ya, review paper. Orang-orang sering berdebat. Nah itu review paper itu kan systematic review, itu kan meta-analysis, itu kan paper review, itu review paper, bahkan dua kalimat ini pun diperdebatkan. Pada prinsipnya adalah review paper itu adalah kita melakukan atau merangkum current state of knowledge of the topic. Jadi ada garis bawahnya, current itu ya saat ini. Kita tidak mungkin namanya review paper, kecuali review paper tentang sejarah, kita menulis yang jauh dari tahun yang sekarang. Maka current state itu penting. Current state itu penting. Nomor dua, tujuan dari sebuah review itu adalah agar kita bisa membuat reader atau pembaca itu mengerti. Sehingga untuk membuat mengerti, maka kita harus melakukan sintesis terhadap berbagai hasil dari bermacam-macam literatur. Sehingga dari situ, ini juga kenapa koheren argumen ini saya sampaikan, saya garis bawahi, itu penting sekali karena seringkali teman-teman atau saya dulu terjebak dalam mensintesis, merangkum tanpa menyampaikan sebuah argumen yang cukup, koheren argumen yang cukup tentang topik atau deskripsi dari sebuah bidang. Oleh karena itu, kalau kita hanya mensintesis, maka tidak ada argumen, maka itu bukan review paper. Demikian juga ketika dalam review paper itu kita harus banyak menampilkan bukti-bukti. Jadi review paper tidak boleh tanpa bukti. Review paper itu men-summarize. Kemudian juga meng-emphasize. Jadi dia harus memberikan suatu titik tekan, kemudian membesarkan mana yang perlu ditekankan dan mengecilkan mana yang tidak ditekankan. Oleh karena itu sebenarnya sebuah review paper itu kalau boleh saya bilang ya dia sangat subjektif dari kita. Tapi nanti akan ada cara-cara untuk mengurangi subjektivitas. Saya rasa nanti di systematic review juga akan ada sedikit subjektivitasnya. Nah, ini saya jelaskan. Tahun 2015 saya menulis review pertama saya tentang sebuah bagai apa lini pertama dari pengobatan Helicobacter pylori resistance. Itu pertama kali saya menulis review paper ini. Yang tentunya ketika saya menulis ini, kalau saya boleh bilang paper saya ini yang pertama menurut versi saya ya paling jelek. Karena saya baru pertama kali menulis, tetapi nanti akan saya bahas. Ternyata paper ini cukup fundamental bagi saya dalam menulis paper. Molecules itu impact-nya sekitar 3, ya. Cukup memberikan impact pada saya pengalaman pertama menulis yang mungkin waktu itu koreksinya juga cukup minimal dari sisi saya karena kita dikejar deadline. Yang mau saya garis bawahi dalam paper ini, saya tidak memakai metode systematic review. Ini adalah review biasa. Review biasa nanti bedanya apa saya jelaskan. Tetapi pada prinsipnya saya ingin ngomong ini adalah review yang tanpa systematic review. Nah, apa bedanya dengan systematic review? Dalam systematic review itu ada sebuah cara tertentu biar kita mencarinya itu secara komprehensif untuk suatu studi atau topik yang relevan dengan suatu metode tertentu yang disampaikan, explicit methods that appraise and synthesize according to explicit method. Jadi harus disampaikan semua apa yang terjadi dalam proses itu pun itu disampaikan. Oleh karena itu, dalam systematic review itu akan ada syarat-syarat. Karena judul hari ini systematic review, maka kita akan banyak bicara tentang systematic review. Tetapi saya kenapa ada slide tentang review saya yang tanpa sistematik itu, saya tidak ingin membuat rekan-rekan yang, karena judulnya ini kan untuk pemula, ya kan? Jadi saya tidak ingin memberikan, membuat rekan-rekan putus asa. Oh ini nanti sulitnya enggak, ternyata itu bisa. Nanti kita dalam forum diskusi kita berdiskusi banyak. Prinsipnya kita untuk tujuan systematic review adalah minimizing bias. How to minimizing bias? Don't do subjective. Jadi kita tidak boleh subjektif. Kenapa? Konklusi dan decision yang dibuat dalam akhir dari review itu juga membuat kita tidak subjektif. Oleh karena itu, systematic review itu sekarang banyak dipakai. Tetapi nanti saya ada catatan underground ya. Underground itu artinya ya tidak ada di buku atau di sini bahwa kapan sih kita menggunakan review, kapan menggunakan systematic review. Nah, teman-teman mungkin bertanya, apa sih bedanya sebuah riset paper sama review? Bedanya apa? Kan saya sudah biasa menulis riset paper. Ingat satu hal, yang pertama tentang tujuannya. Review paper selalu menganalisis previously published literature on a specific topic. Pertanyaannya, bolehkah kita membuat sebuah penelitian dan menuliskannya sebagai review paper? Loh, kalau sebagai research paper, original artikel kan biasa. Tetapi apakah bisa kita itu menganggap itu, kita buat itu sebagai sebuah review paper? Bisa, jika merupakan part of. Jadi kalau kadang-kadang di tengah-tengah review paper itu kita menulis data yang sudah kami ada adalah bahwa di Surabaya saat ini COVID-19 penderitanya sebanyak sekian. Tidak ada publikasinya, itu data Anda, hasil dari original ticker. Dikasih dalam kurung unpublished data. Tetapi ingat, ada beberapa paper yang dia meminta untuk, paper itu diminta untuk tidak menyertakan unpublished data. Atau in press, itu juga tidak. Tapi kadang-kadang in-press ini lebih galak, mereka mintanya unpublished data, it's okay. Gitu ya. Yang kedua, itu makanya disampaikan. Nomor 2, it doesn't report any original research. Nah, saya belajar bahwa, oh ternyata tidak sekaku itu sebenarnya. Tetapi ini panduan utama, seharusnya kita tidak menunjukkan hasil data apapun. Tetapi biasanya, kadang-kadang kita itu dalam review paper itu ingin mengemphasize kepada para reviewer, kepada editor, we have experience. Jadi kita mempunyai experience untuk bidang ini. Oleh karena itu kadang-kadang ya dalam review artikel itu kita itu agak gede rumongso orang Jawa ya. Jadi kita itu menampilkan paper-paper kita sendiri beberapa kali. Loh, kenapa kok harus dilakukan seperti itu? Ya, karena kalau kita tidak menampilkan paper-paper kita ini secara khusus, maka mungkin editor akan bertanya, kenapa kamu menulis paper ini, review? Kamu berpengalaman nggak? Kamu mengetahui topik ini apa tidak? Itu juga penting. Nah, kemudian ketika kita melakukan review itu, seharusnya kita secara bisa melakukan komunal, ya, communalities. Jadi kalau kita dari berbagai data semuanya, informasi semuanya kita menyajikan. Problem, apa yang disampaikan kita secara seimbang belum tentu dianggap oleh orang seimbang. If there are discrepancies, then the authors try to provide reasons for conflicting results. Tetapi kadang-kadang nggak begitu. Kadang-kadang kita ketika mendapatkan itu, pasti ada keberpihakan, itu ada. Keberpihakan bukan keberpihakan secara subjektif. Kadang-kadang, oh yang saya percayai, itu begitu. Helicobacter pylori itu sudah sejak tahun 1982 ditemukan. Sampai saat ini sudah masih ada konflik interest. Apakah semua Helicobacter pylori itu harus dieradikasi atau Helicobacter pylori itu kadang-kadang mempunyai keuntungan karena dipercaya sejak 20.000 tahun yang lalu dia sudah out of Africa. Sudah lama dia tinggal bersama manusia. Kenapa harus dilakukan eradikasi? Kemudian panjangnya bagaimana? Rata-rata sekitar 4.000 atau 5.000 kata ya, tanpa reference. Tapi ini sebagai pertimbangan nanti mungkin berkembang. Dok, kalau mini review gimana? Kalau letter to editor apa bedanya dan sebagainya? Tentunya nanti berkembang. Tapi saya menyampaikan secara umum yang tentunya sangat tergantung dari paper-paper yang kita ingin submit. Nah, apa yang penting dari sebuah systematic review? Satu, clear inclusion dan clear dari exclusion criteria, ada strateginya, ada coding, ya, ada coding mana yang di-included dan bisa dilakukan meta-analysis. Later Professor Liao will explain about it. Okay. And ini salah satu review yang paling diakui di dunia itu adalah Cochrane. Kalau dalam orang Islam itu ada namanya Bukhari dan Muslim, ya. Pokoknya adalah sebuah data yang hampir diakui kebenarannya gitu ya. Maka Cochrane ini kalau dalam dunia review paper dianggap sebagai sesuatu yang utama, salah satu sebagai acuan Cochrane review. Makanya kalau kita menyitir adalah Cochrane review menyampaikan yang tentunya dia mendapatkan hasil ini luar biasa. Kalau khusus Cochrane review walaupun dia menulis hanya review saja, maka sudah otomatis ini adalah systematic review dan meta-analysis. Khusus Cochrane review dan prosesnya jangan salah bisa sampai 4-5 tahun Anda melakukan review bersama Cochrane review. Nah, kira-kira strateginya begini. Kalau kita melakukan systematic review tentunya harus ada research question. Kita kadang-kadang problemnya menyantumkan research question itu terlalu lebar. Saya contohkan publikasi saya yang pertama, review itu ketika saya menulis first line of the H. pylori antibiotic resistance eradication. Saya pertama menulis itu. Cukup sempit nggak? Sempit versi saya waktu itu. Tapi ketika saya mengumpulkan data, luar biasa banyak. Kalau kita mengumpulkan data sebegitu luar biasanya, kita tidak akan mendapatkan apa-apa. Kenapa? Terlalu banyak yang harus kita tampilkan. Malah bingung ngatur, saya mungkin sekitar 3 bulan pertama menulis itu. Bingung gimana sih caranya nulis review, mencari akhirnya titik temu bagaimana. Kemudian ternyata saya akui, oh tidak. Kalau ini saya batasi hanya pada Asia, maka ternyata tidak begitu luas. Papernya masih sanggup saya baca. Dan luar biasanya ternyata ketika kita melakukan review-review yang kira-kira mempunyai keluasan tema, tetapi dispesifikan kan, judulnya kan first line regimen of eradication antibiotic resistance ×2 ASEAN perspektif. Artinya saya membatasi topik saya pada ASEAN perspektif Asia, sehingga cukup singkat. Dan di luar dugaan akhirnya citasinya salah satu citasi tertinggi dari paper-paper saya ya adalah paper ini. Karena saya menyajikan berbagai hal. Oleh karena itu penting research question. Karena tanpa research question yang jelas, maka kita akan sulit. Caranya nggak apa-apa, anggap luas atau tidak bagaimana? Tulis saja research question-nya. ya, research question, kemudian coba dicek. Kalau jumlahnya lebih dari 2.000, wallahu a'lam bishawab, ya, tidak akan selesai. Maka harus dicari sebuah keywords yang nanti berkaitan dengan nomor 4 itu, search strategy untuk mencari di searching database itu sesuatu yang cukup simple. Sehingga jumlahnya mungkin 1.700, 500, masuk akal. Masuk akal. Nah, kita nanti harus seperti ini kalau systematic review. Berapa yang dimasukkan ininya, dan kita harus fair dan bagus. Saya pernah membuat sebuah systematic review, ya. Kemudian saya menganalisis, harus mencari kelemahan systematic review sebelumnya dan juga meta-analisis sebelumnya. Mana kelemahan? Luar biasa, itu terbitan dari sebuah negara di Asia Timur, ya. Dia memakai hasil akhirnya itu hanya 10 paper untuk dilakukan analisis. Jadi karena hanya 10 paper, maka dia langsung mengambil sebuah maaf ya, saya diminta berganti wifi, sorry. It's done with pylori 3. Okay. I'm sorry. Oke, karena kita ketika saya cek itu hanya 10 paper. 10 paper mereka ambil kesimpulan, akhirnya kesimpulannya itu bias, ya. Oleh karena itu nanti kita akan banyak diskusi, ya, tentunya masih ada subjektivitas tergantung kita. Oleh karena itu yang pertama, apa yang kita lakukan, tentukan topik sama audiens. Apa yang menjadi harus kita tertarik kita. Kemudian harus penting untuk sebuah field. Kalau hanya penting untuk Anda, ya nggak laku, nggak akan diterima. Dan tentu saja well-defined issue, itu juga penting. Artinya, sebenarnya publikasinya itu sudah banyak, tapi review kita ini hanya mengulangi, ya buat apa? Tetapi kalau ada tahu 1.000, kemudian ada konflik, kita review, kita menyampaikan, kemudian kita memberikan pendapat, itu bagus. Nah, kemudian setelah itu cari itu harus mencari pada hal-hal tadi, ya, sudah saya sampaikan di atas, M.Kes, in PubMed, ya. Saya tidak menyarankan Google Scholar sebagai bagian, ya, tetapi mungkin bisa di tempat-tempat yang lain, ya. Kemudian jangan lupa setelah kita mencari, keep track on the search items, itu harus disimpan. Kenapa? Ketika kita tengah-tengah menulis, kemudian kita, masih ada paper baru enggak? Maka kita secara konsisten di search itemnya itu kita tuliskan kan nanti, saya keywordnya pakai ini. Nah, jadi jangan sampai hilang. Kemudian define early in the process some criteria for exclusion and then irrelevant. Kenapa? Nanti kita bisa trial berkali-kali. Nah, saya pakai ini nanti jadinya berapa? Nah, kali ini jumlah papernya berapa? Kita bisa bermain di sana. Nah, ini yang menurut saya paling penting. Kapan sih kita ini menentukan sebuah literatur review? Nomor 1, jika jumlah paper literatur review itu masih sedikit dan jumlah publish risetnya itu sudah banyak, itulah poin utama kita. Penting bahwa need for a literature review. Itulah saatnya di mana review paper yang lainnya belum muncul. Kemudian jumlah paper yang sudah publish banyak. Nah, tetapi kalau sudah papernya banyak, reviewnya juga banyak, ya review of reviews. Jadi kita harus ngambil review of reviews. Kemudian kalau jumlah reviewnya banyak tetapi jumlah papernya sedikit, maka mungkin saja review itu bisa dibuat, bisa saja tetap dibuat. Tetapi kita pada konklusinya masih membutuhkan banyak publikasi tambahan. Jadi harus ada conflicting atau otomatis menurut saya. Conflicting dan jumlah papernya sedikit. Demikian juga apalagi kalau jumlahnya review sedikit, jumlah papernya sedikit, maka perlu identifikasi dari research question, jangan-jangan pertanyaan penelitiannya ini keliru, apa yang kita masukkan keywordnya ini keliru. Nah, rule nomor 2 setelah lanjutannya ya, setelah nanti sudah search and research, jangan lupa membandingkan cara pendekatan, limitasi dan kesimpulan dari review-review sebelumnya. Review sebelumnya itu menyatakan apa sih? Padahal di analisis jenengan, di analisis kalian, itu menyatakan yang sebaliknya. Atau memang mendukung. Itu biasa, dua grup di dunia ini saling bertarung untuk sama-sama memberikan pendapat, itu biasa. Tapi ada yang penting bahwa trying to find new angle. Kalau nggak new angle, maka ini nggak laku. Nggak laku. Ya. Nah, kemudian kalau sudah cari di Scopus, Web of Science, di Medline, ditentukan nanti ya. Jadi kalau kira-kira, kalau ini ada salah satu terbitan saya, kita melalui PubMed, Web of Science, M.Kes, Cochrane Library, search all with keywords-nya apa? Plug. Setelah itu kita include semua artikel. Jangan begitu. Itu nanti dengan itu semua akan jelas. Tetapi karena ini kan namanya pemula. Pemula nggak apa-apa, saya tunjukkan hasil akhir kan gitu. Pemula, apakah harus begini? Ya nanti kita dalam forum diskusi menurut saya perlu sampaikan kadang-kadang mungkin sekarang ya, mungkin kadang-kadang kita itu kalau berada di titik ini, kita di titik need for review of reviews kayak saya menulis pertama. Orang-orang yang menulis tentang antibiotic resistance or first line ya, hanya first line-nya saja, yang tentang mirip dengan paper saya itu banyak. Kalau saya harus mengumpulkan paper sebegitu banyaknya dengan keyword tertentu dan sebagainya, luar biasa berat. Oleh karena itu, saya secara subjektif mengambil jurnal-jurnal yang cukup bagus untuk saya sebagai tolak ukur, sebagai referensi untuk agar saya mengambil itu sebagai acuan. Jadi akhirnya saya memutuskan, cukup. Akhirnya saya putuskan kira-kira 100 paper yang saya tentukan sebagai bahan baku dari pembuatan review saya. Itu nanti berbeda konsepnya ya. Kemudian kalau sudah, jangan lupa kalau nanti mencari jangan lupa membuat catatan. Ini penting sekali. Jadi usahakan begini caranya. Buka Microsoft Word, Anda membaca artikel itu satu. Baca. Ambil sebuah kesimpulan tentang paper itu yang sudah dilakukan paraphrase. Jadi kalau sulit, ambil saja kesimpulan, copy paste, taruh di situ. Kemudian baru lakukan paraphrase di situ. Paraphrase Indonesia kayak paraphrase bahasa Inggris kayak mau di Google Translate kayak terserah. Yang penting masukkan Microsoft Word dulu. Ingat, tambahkan hal-hal yang penting. Misalkan, paper ini menarik karena 10.000 orang with 10,000 participants of the study. Itu kan besar. Itu kumpulkan. Oke? Kumpulkan. Kemudian jangan lupa yang terakhir. Using referencing software. Ini adalah kunci kesuksesan. Kalau Anda nggak melakukan ini, nanti kayak saya nggak nurut awalnya, susah setengah mati. Jadi kalau sudah menulis, langsung masukkan referensi. Terlepas kalau ada kemudian referensi Anda menumpukan referensi yang lebih bagus, kemudian Anda mengganti, itu urusan nomor 100. Itu urusan nomor 100. Urusan nomor 100. Ya. Kemudian tipe review itu banyak. Mini review, full review itu nanti kita jelaskan. Tapi pada prinsipnya ini nanti tergantung jumlah kata ya. Kemudian fokus reviewnya ya, fokus. Kita menulis mini review sama full review itu nanti tantangannya berbeda. Kalau mini review itu simple, kalau full review panjang dan besar ya. Be critical and consistent. Jadi kalau dia itu kita harus ada sebuah forum diskusi di situ melakukan kritisi terhadap sebuah jurnal. Jadi misalnya jurnal ini bagus, tetapi dia hanya membawa 68 subjek misalnya. Berbeda dengan jurnal lainnya, jurnal ini menambahkan kesimpulan bahwa begitu. Ini tentunya menjadi kontroversi dibanding penelitian sebelumnya, itu penting. Nah, kayak gini, pada akhirnya, akhir dari paper itu, kita memberikan sebuah pertanyaan. Is H. pylori infection is beneficial? Jadi setelah kita melakukan summary terhadap itu, maka ya, saya tadi di moderator waktunya kurang dikit, maka saya cepatkan. Kalau sudah, cari itu phenological structure. Saya rasa nanti ini sesuai dengan paper. Kemudian kalau sudah, jangan ragu-ragu, kirim ke teman sejawat, kirim ke good review, minta pendapat. Kadang-kadang ya good review hanya membaca judulnya, wah nggak laku ini. Membaca abstraknya saja, wah nggak laku. Maka perlu ya, include your own relevant research, but be objective. Boleh kita memasukkan, tapi harus objektif. Seperti saya katakan, malah itu jadi penting. Be up to date, but do not forget older studies. Jadi kalau ada paper-paper yang original, berbeda dengan Anda menulis tesis, menulis disertasi, pokoknya harus 5 tahun terakhir, tidak. Dalam review, kalau ada sebuah paper yang menurut kita itu penting, pylori ditemukan tahun 82, itu paper itu sangat penting, harus memasukkan original artikel. Bagaimana format? Saya coba cepat, semestinya pendek ya, spesifik, informatif, sekitar 20 kata, title written in language ya, according of course ya, international ya. Jadi saya contohkan. Helicobacter pylori as an oncogenic pathogen, tapi kita nulisnya revisited. Artinya apa? Kita menampilkan dalam pesan dalam judul itu, H. pylori as an oncogenic pathogen is usual, it is usual title, but we have the concept that recent concept is needed to revisit. Kita menyampaikan pesan. Atau sekalian kita menulis secara detail Helicobacter pylori virulence and host genetic polymorphism as risk factors for peptic ulcer disease, itu kita secara lebih sudah detail saja, nggak ambil perkara. Atau kita menampilkan sebuah kontroversi, Helicobacter hygiene hypothesis atau asma, is it true? Have relation? Is it true? Is still controversial, I think until now. Jadi kita menyimpulkan. Jadi judul-judulnya itu yang provokatif. Judul-judulnya provokatif. Abstrak saya rasa tidak ada masalah, 300 kata. Penting bahwa abstrak itu adalah brief summary yang akan diperhitungkan. Jadi menulis abstraknya harus perfect. Harus perfect seperti ini. Nanti mungkin nanti kalau ada pertanyaan mungkin coba PM untuk PDF ya, PDF dari slide. Kemudian introduction. Sama dengan kita membuat original artikel, tetapi the end of the section you have to write what is your goals. I think it is similar with the original article, but biasanya introduction itu lebih pendek pada review artikel. Singkat, apa sih maksud, kenapa sih kita menulis sebuah review itu? Ya, jadi kenapa sih? Jadi cukup dengan beberapa kata. Ingat gini, ini kebiasaannya orang Indonesia. Kita ini sering diajari kalau menulis tesis, nulis kata-kata bla 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 bla, pada akhir paragraf itulah referensinya. Referensi lebih dari 1. Itu berbahaya. Jadi tiap kata at the very end of the sentence, the introduction should mention the purpose. I think it is not incorrect. Mention the reference, ya, the reference. Jadi referensinya harus dimunculkan. Karena kalau tidak kita munculkan referensinya, maka berbahaya karena kita akan dicap include as plagiators. Ya. Jadi kira-kira begitu. Terus kemudian untuk bodinya bagaimana? Oh ya, ingat, kita tidak biasa dalam menulis review paper itu ada subtopik. Jarang. Saya pernah satu kali, nanti saya contohkan subtopik. Tapi saran saya, hindari subtopik. Subtopik itu apa sih? Misalkan, kita kan biasa di bab 2 itu, 1.1 apa Helicobacter pylori, 1.1 faktor resiko Helicobacter pylori, kan gitu. Itu tidak ada dalam review paper. Judul dari tiap section, tiap judul itu harus provokatif dan keren. Biasanya satu tema, misalnya saya nulis saja Helicobacter pylori infection, sudah gitu dok. Mari habis gitu pada berikutnya ada subsection lagi, gastric cancer risk associated with Helicobacter pylori. Misalnya begitu. Nah, jadi tidak ada subsection. Nah, ini saya contohkan subsection. Ada positive studies misalkan, itu subsection ya. Tapi kita terpaksa waktu itu karena terlalu banyak paper, jadi create a structure that relevant and relevant the title, avoid using one reference in one paragraph. Ini untuk pemula penting sekali. Jangan memakai referensi pada satu paragraf. Satu kalimat, satu paragraf. Every sentence or two is closed with reference source ya. Oke, saya teruskan. Nah, ini yang penting juga. Tabel. Jangan pernah memasukkan tabel milik orang lain. Tabel milik orang lain itu adalah plagiasi, Bapak Ibu sekalian. Jangan mengambil tabel kemudian Anda copy paste taruh di situ. Ini adalah gambaran yang secara umum ya, tapi tentunya menurut saya ya tidak boleh dilakukan. Tetapi orang biasanya menulis review adalah men-summary. Ini saya contohkan yang di bawahnya adalah merangkum seluruh paper-paper yang terkait dengan itu wajar. Itu wajar. Loh, Dr. Miftah itu kok ada p-value, Anda menghitung meta-analisis? Enggak. Ini bukan meta-analisis, ini hanya sebuah systematic review, kemudian kita ukur anunya ya. Kemudian seperti ini juga kita menunjukkan. Jadi paper dari chapter-chapternya itu jelas. Negative studies, cause studies ini nanti penjelasan berikutnya. Meta-analisis ya. Kemudian yang seperti saya sampaikan tadi, terakhir harus ditutup pendapat kita tentang itu ya. Conclusion bagaimana? Saya rasa conclusion pada review paper itu adalah section yang paling sulit. I think the most difficult because you have to make a conclusion about many papers. You have to show where is your side. Jadi kita di sisi yang mana? Mendukung atau tidak mendukung? Apa di tengah-tengah? Perlu penelitian berikutnya untuk menentukan. Nah, di tengah-tengah ragu-ragu. Tapi biasanya saya akan memberikan sebuah pesan yang jelas. Pesan jelas contohnya gini. Misalkan kita akan ngomong bahwa pada seluruh Helicobacter pylori di dunia ini harus dimusnahkan karena tidak sesuai dengan pri kemanusiaan dan pri keadilan. Gitu. Kita harus menyampaikan ya. Ya, jadi conclusion jelas ya, conclusion bahwa menyampaikan bahwa misalkan ternyata hipotesis tentang pylori dan spesifik pylori antigen untuk pelindungi asma is not supported by current data and was falsified in experiment testing projection of the hypothesis. 3 kalimat paling panjang dan harus jelas. Inilah ngajak tawur orang, iya resiko. Nulis review paper berpihak. Nah, Anda nggak berpihak nggak laku Anda. Ya, saya rasa itu nanti secara reference harus memakai reference manager. Saya rasa ya nanti terakhir ya, are you including more than one study design? Saya tadi menunjukkan positive studies, negative studies, meta-analysis. Kadang-kadang saya harus mengumpulkan. Tidak adil toh kita membandingkan sebuah meta-analysis dengan sebuah studi yang cross-seksional. It is not. I think it is not in the same level. It is different level. We cannot compare some RCT with only a study, only in a center. Multi-center only with a center. I think it is not similar. So kalau memungkinkan ya dipisahkan, sehingga asumsi kita atau penilaian kita cukup bagus ya. Kemudian yang kedua, apakah ada beberapa studi yang punya nilai beda? Itu penting. Jadi kita punya 100 paper nih. Kita berpendapat ini pokoknya menurut pengetahuanku itu saat ini adalah A. Ini kesimpulanku. Ternyata ada paper yang ngomong B. B-nya itu disendirikan. Ini harus jadi baceman untuk melawan pendapat Anda. Should you include it? Tergantung Anda. Kalau Anda berani bertarung dengan fair, masukkan. Kalau Anda tidak berani bertarung, ya makanya saya bilang subjektif ya. Ada subjektifnya. Be careful about collecting extra data. Kalau tidak sudah memakai keyword nih, ketemu 100, ya ada 5 pesanan harus masuk, hati-hati. Harus ada reasoning, good reason for extra data. Ya. Terus kemudian hindari yang tidak langsung untuk review question, dan harus ingat kembali protokol time and effort to collect only to find it is not useful. Jadi kadang-kadang kita itu terjebak mengumpulkan, tapi kemudian tidak fokus, lupa, kita mau menulis tracknya, akhirnya nggak karu-karu yang ditulis. Sebaliknya, kita sudah terlanjur nulis, time effortnya itu untuk nulis, collect datanya tidak betul, ruwet juga. Karena penulisannya jadi subjektif. Ya. I think it's all, Dr. Yudith, Annisa. Thank you very much. Maybe we can continue to the second. Thank you.
Thank you, Dr. Miftahussurur, for the lecture. It was a very thoughtful and insightful presentation indeed. Okay, once again, for all our participants that joining us either in the Zoom meeting room or in our YouTube streaming channel YouTube, you may send questions to all of our speakers and write it down on the chat room, and then we will discuss them at the end of the session. Right, okay, entering our second session that will be delivered by our distinguished guest from Taiwan University, Professor Liao. Let me introduce our second speaker to all of our participants by showing and reading his brief CV and background. So, our guest here, Professor Wei-Chih Liao, is an associate professor from National Taiwan University College of Medicine with education background, epidemiology and preventive medicine. His home institution is the Department of Internal Medicine, National Taiwan University Hospital. His research interest is clinical and epidemiological research on pancreatic cancer and pancreatitis, biliary and pancreatic endoscopy and endoscopic training. His publication is Cystic 4 with an H index of 20. His award honors as follow: American Society for Gastrointestinal Endoscopy Ambassador, Outstanding Research Award for Junior Faculty, National Taiwan University Hospital, Emerging Star World Endoscopy Organization, and Outstanding Reviewer for GIA Gastrointestinal Endoscopy 2012, 2014, and 2016 to 2018. For the second session, we can proceed Professor Liao to give his lecture. The time is yours, Professor Liao.
Okay, thank you. So first, I would like to thank Dr. Miftah for having me in this great meeting. It's really my great pleasure and honor to be able to share my experience in meta-analysis with all of you. So everyone, good afternoon. Allow me to share my screen with you. Can you see my screen?
Okay, not yet, Professor.
Somehow. Okay, sorry for the delay.
Okay.
So can you read now?
Okay, perfect, Professor.
Okay. So I think Dr. Miftah has already given you an excellent talk on meta-analysis. I think his talk was so comprehensive, so excellent that I probably can add a little to his speech. So I will try to highlight a few things that I think is important when you conduct a meta-analysis and write a manuscript. And also I will use a few examples to share my experience with you. So is my voice clear? Okay, I will proceed.
Yes, Professor, very clear.
So before starting, I'd like to reiterate why meta-analysis is important. This is a quote from The Lancet, which says that to embark on research without reviewing systematically evidence of what is already known, particularly when the research involves people or animals, is unethical, unscientific, and wasteful. So with this in mind, I think we will be able to know better what we should do when we conduct and write a meta-analysis. So meta-analysis is now increasingly requested by major funders and journals. So this is a lesson from the history. You can see that 17 trials have been conducted to study the effect of beta blockers for acute myocardial infarction. However, if you look at the right panel, you can see that if every trial looks back and analyze all the patients before it, then you can see that after the 6th trial, the benefit of beta blockers is significant. So this means that all the trials after this one was not necessary. And many patients who were enrolled into all these trials could have received better care. So this is another example showing thrombolytic therapy for acute myocardial infarction. Again, you can see that if all the patients have been pooled and analyzed together, from the 6th trial, the benefit was already significant. So the trial before the 6th could have been avoided. So meta-analysis is quantitatively combining multiple studies. And in my talk today, I will focus only on studies on meta-analysis of RCT, randomized controlled trials, because this is the most important type of meta-analysis that informs us the comparison between different treatments for a certain disease. A meta-analysis of RCTs can provide a pooled estimate of the effectiveness of each treatment. And very importantly, a meta-analysis is an objective, unbiased evidence synthesis. It should be reproducible. So when conducting meta-analysis, it is very important to avoid introducing personal belief into the process. Ideally, meta-analysis should be reproducible. Everyone using the same criteria can also reach the same conclusion. Okay, so because the meta-analysis combines results from multiple studies, therefore the sample size is greater. So it has a higher statistical power and thus are more likely to be generalizable to the wider population. Therefore, it is more powerful compared with a single study to know the effect of a certain treatment. And it can enable us to quantitatively assess why the treatment effect is different across different studies and try to attribute the between study variations to different factors And it is so-called heterogeneity and the exploration of sources of heterogeneity. So conducting a meta-analysis is like solving a jigsaw puzzle. After the meta-analysis, you will be able to pull everything together and provide a clear picture of available evidence. So the first part of the talk title is choosing the best theme. I think Dr. Miftah has already given you a very good explanation on how to choose the best theme. I think the most important thing that I want to reiterate is to find the important questions. Questions that controversies exist and that has great clinical impact, especially when there are conflicting or mixed results between studies. Then it is probably a very good topic for conducting meta-analysis. And the second thing is to have adequate quantity and quality of available evidence to allow conducting a meaningful meta-analysis. Because if you have a very good question, but the available evidence is very limited, then you don't have enough evidence to conduct a meaningful meta-analysis. So let me explain the workflow. When you think about conducting a meta-analysis, the first thing is to do a literature review, to generate some ideas and find good topics for a meta-analysis. You have to start from finding major studies on the research question you are interested in. And then you have to critically appraise the available evidence. And you have to look for the opinions in review articles and the major opinion leaders. And this will help you to understand what is already available on this issue and to understand whether there are certain important directions, unsolved problems, or knowledge gaps that must be addressed by a meta-analysis. And very importantly, you have to look for previous meta-analysis that have been done on this issue. A previous meta-analysis does not preclude the necessity of a new meta-analysis. However, you have to think carefully whether a new meta-analysis is needed and what are the weaknesses or inadequacies of the previous meta-analysis that you must address in your new meta-analysis. And once you identify the major knowledge gap, then you have to think about its clinical relevance. How important is this question? And what are the likely audience if you write up a manuscript on this meta-analysis? Who are interested in your results? Then if your question is important and relevant to a wide audience with great clinical impact, then you have identified a good topic for meta-analysis. Okay, so after you have decided upon the topic, then you have to conduct a formal literature search to identify all the studies and then review the eligibility of each study to decide which one to include and which one to exclude. And after that, you have to do data extraction to extract the relevant data and for subsequent systematic review and meta-analysis. And I will elaborate further. The literature search should be performed by at least 2 independent researchers, and they should identify all evidence. And this must be done through searching more than one database. So the most commonly used ones are the PubMed and something like the Scopus, etc. And you have to look for trial registry and also manually review and search the references included in major review articles. And it's important to document your search strategy and history to make sure that you have identified all the relevant studies and the literature search process is reproducible. And it's important to specify the inclusion and exclusion criteria explicitly. Assessing the eligibility of the studies should be unbiased. At this stage, it's important to avoid including or excluding a certain study based on personal belief. The selection process must be done based on pre-specified inclusion and exclusion criteria. And then move on to the data extraction. Again, this should be done by 2 researchers independently. The data that needs to be extracted are many, but most importantly, the features of the study, for example, the year, publication, place of study, and the features of the patients, the inclusion, exclusion criteria, etc. And it's important to extract variables that are related to the quality of each study. And of course, the results of each study must also be extracted carefully. And the data extracted by the 2 researchers should be verified. And any disagreement should be addressed and resolved by consensus. So this is a flow diagram provided by the Prisma Guideline. The Prisma stands for Preferred Reporting Items of Systematic Review and Meta-Analysis. So this is a guideline that everyone should follow when conducting a meta-analysis. So you can see that this flow diagram summarizes clearly the literature search and study selection process. So you have to record your search and selection history to come up with this diagram. Okay. Once you have done the data extraction, the next step is systematic review. It is a narrative review. The aim is to qualitatively review and synthesize the available evidence. It is important to know that it's not always possible to conduct a meta-analysis, which is a quantitative synthesis of available evidence. For example, sometimes the available evidence is too scarce. Only 2 studies are available. In that case, it's probably not feasible to conduct a meaningful meta-analysis. And sometimes the studies look at very different population, or the outcomes are different, or the interventions are different. So in that case, pooling those studies that are very different in either participants or outcomes are not useful because the results is not applicable. You cannot compare oranges with apples. So at the stage of systematic review, you have to review the evidence to decide whether a subsequent meta-analysis is feasible. Once you have decided to conduct meta-analysis, then you have to choose the appropriate measure, whether it's odds ratio or hazard ratio, etc. And also you have to decide the method, which I will elaborate further. And then you have to assess the risk of a bias. There are 2 possible sources of bias. Some bias are in the individual studies itself. It could result from, for example, whether randomization is appropriate, whether blinding is adequate. And another source of bias is at the study outcome level. For example, studies that report negative results may be rejected from publication, and only studies that reported positive results are published. So if you do your meta-analysis based on studies that have been published, then the result could mistakenly suggest that the treatment is effective. So this is the so-called publication bias. Okay. So after you assess the risk of bias, then you do quantitative synthesis of the evidence. And after that, you have to assess consistency across the studies, which means that whether the treatment effect is similar in different studies. Sometimes the treatment effect differs widely in the individual studies. Then you have to explore what is the source of heterogeneity. It's very important because there are important factors that could influence the treatment effect. And a very important mission of a meta-analysis is to identify these important factors and analyze how these factors influence the treatment effect. And this I will elaborate further with some examples. So in terms of the meta-analysis, the traditional, you are most familiar, the most common meta-analysis to combine and to compare 2 treatments. This is so-called pairwise meta-analysis. And there are certain more advanced meta-analysis methods. For example, when there are more than 3 treatment modalities, then you have to combine and compare the different treatments. Then this is so-called the multiple treatment comparison or network meta-analysis. And sometimes you can study the dose-response relationship between a certain exposure and the outcome. This is so-called dose-response meta-analysis. And this is not the major focus of my talk today, because these are the methods cannot be covered very clearly in such a short time. And there are very good references and statistical packages that can enable you to conduct such advanced meta-analysis now. A very brief explanation is the network meta-analysis can compare multiple treatments together. And then you can compare two treatments using studies that directly compare the two treatments. And also you can compare the two treatments indirectly using studies that compare them either one with the other treatments. Okay, I'll skip this slide. Then I'll briefly talk on writing technique. Dr. Miftah has already given you a very good talk on how to write a good paper on meta-analysis. The Prisma Guideline also provides a checklist to remind you what you need to include in your manuscript. So it's very useful if you use this checklist to guide your writing. Now, after you have completed a meta-analysis, and then when you are writing your manuscript, the most important thing to remember is to put your results into context. And very importantly, you need to emphasize how your results close the existing knowledge gap, how your meta-analysis settle current controversies on this issue. By doing so, you will boost your chance of being accepted in a good journal. So I will try to use a meta-analysis that I published a few years ago in clinical gastroenterology and hepatology as an example. This meta-analysis compares two different treatments during ERCP to gain biliary access. As all of you know, for example, when we want to extract a bile duct stone, we need to open up the bile duct orifice. The traditional way is to do an endoscopic sphincterotomy, or EST. Another alternative is endoscopic papillary balloon dilation, which is so-called Ppjpi. And this technique uses a balloon to dilate the biliary orifice. A previous meta-analysis published in 2004 concluded that for treating bile duct stones, these two techniques have equivalent efficacy and the overall complication rate. However, the balloon dilation has a high risk of pancreatitis, but a low risk of bleeding. And after this meta-analysis, it is generally considered that sphincterotomy is the standard treatment. And because of the high risk of pancreatitis after a balloon dilation, the duration of balloon dilation should be short, less than 1 minute. And so there's a trade-off with balloon dilation. You reduce the risk of bleeding, but there is a high risk of pancreatitis. However, in a subsequent randomized control trial, we found that the duration of dilation influences the success rate of stone extraction and the risk of pancreatitis after ERCP. If you dilate for 1 minute, the risk of pancreatitis is 15%, significantly higher than 5-minute dilation, in which case the risk of pancreatitis is only 5%. So this raises an important question. The previous meta-analysis compares sphincterotomy and balloon dilation only, without consideration of the duration of balloon dilation. Now we know that dilation duration influences the risk of pancreatitis. What if we separate the balloon dilation studies into short balloon dilation and long dilation, defined as either a dilation duration of less than 1 minute or longer than 1 minute, and then compare these two different dilations with sphincterotomy. So we did a meta-analysis to compare short dilation versus sphincterotomy and the long dilation versus sphincterotomy, and then combine the 3 different treatments. So this diagram shows the process of literature search and study selection. And usually the first table will summarize the results of each individual studies. And this is the Cochrane risk of bias tool. This enables us to assess the risk of bias in each individual trial. As to possible bias in the study level, this is very commonly used. The funnel plot and the eager test can examine whether small study bias, or frequently referred as publication bias, exists or not. Then move on to the results. We can see that if you compare short dilation with sphincterotomy, the risk of pancreatitis is significantly higher. However, for studies using long dilation durations, the risk of pancreatitis is comparable with sphincterotomy. So in terms of overall complications, you can see that there is a trend toward more overall complication for studies using a short dilation duration. On the other hand, for studies using long dilation durations, the overall complication rate is similar between balloon dilation and sphincterotomy. So this is a more advanced computer simulation, which shows that in a 150 rounds computer iteration, a long dilation duration balloon dilation is the safest treatment among the 3 in 90% of the chances. So another important thing that we can do in meta-analysis, as I just mentioned, is to evaluate how important the importance of a certain factor in affecting treatment effects across studies. In this example, we are interested in how dilation duration affected the outcomes. So we can use a meta-regression to look at the relationship between dilation and the risk of pancreatitis. And you can see that with every 1 minute in dilation duration increase, the risk of pancreatitis after dilation reduces by 40%. And this also shows that the overall complication is similar. The longer the dilation duration, the lower the risk of overall complication. So the result of this meta-analysis tells us that the dilation duration actually is inversely associated with pancreatitis. So the previous recommendation that the dilation should be less than 1 minute is harmful. It actually increases pancreatitis. On the other hand, dilation with an adequate duration has comparable pancreatitis risk, but probably a lower overall complication rate than spironolactone. So this is an example showing how a renewed meta-analysis can provide an updated knowledge and could change clinical practice. I would like to use another example to show how meta-analysis can change clinical practice. And this is a clinical practice, a meta-analysis that I published a few years ago in the Lancet Oncology. The topic is adjuvant treatments for resected pancreatic adenocarcinoma, a systematic review and a network meta-analysis. Some background context. As all of you know, surgery is the only chance of cure for pancreatic cancer. However, in more than 80% of patients, cancer recurs after surgery. Therefore, adjuvant therapy has been advocated to reduce relapse and prolong survival. However, the treatment strategy remains controversial. What are the possible adjuvant therapies for pancreatic cancer? Of course, some people would opt for observation only without adjuvant chemotherapy. And at the time of this meta-analysis, some studies use the chemotherapy alone, such as fluorouracil or gemcitabine. And some studies use the chemo radiation alone, which is a combination of chemotherapy as a radiosensitizer plus radiation. And some studies would use chemo radiation and chemotherapy, either 5-FU or gemcitabine. Then there are many controversies surrounding this issue. The first is, which one is better, 5-FU or gemcitabine? The ASPECT-1 trial showed that 5-FU with or without chemoradiation achieved better survival compared with no 5-FU, either without chemo or either with or without chemoradiation. However, this study used a complex vectorial design, and the results are frequently questioned. The CONCO 001 trial showed that gemcitabine had a marginal survival benefit over observation alone. The p-value was 0.06. The use of chemoradiation is even more controversial. It is considered as the standard of care in the US. However, in the UK and Europe, chemoradiation is considered to be harmful because the SPEC-1 trial showed that chemoradiation, either with or without 5-FU, had a worse survival compared with patients without chemoradiation. However, because in the patients without chemoradiation, some received 5-FU, and the rest did not receive any chemotherapy. So again, whether this study provides a definitive answer on the effect of chemoradiation is controversial. So to summarize, it was not clear what is the best chemotherapeutic agent for adjuvant chemotherapy in pancreatic cancer. And it is not clear, the size of survival benefit is not clear. And whether chemoradiation is harmful or beneficial is not clear. So in this meta-analysis, we aim to compare all the different treatment strategies with respect to overall survival and the overall hematologic, non-hematological toxicity. So you can see that there are 6 different treatment strategies compared in this meta-analysis. And then you can see the results for overall survival. So this shows that when you compare fluorouracil with observation, the hazard ratio for death is 0.62. And if you adjust for the percentage of lymph node involvement in each study, then the hazard ratio for death is 0.65, meaning that fluorouracil can provide a survival benefit compared with observation. Similarly, you can see gemcitabine also shows benefit compared with observation in terms of overall survival. However, when you look at chemoradiation plus 5-uracil or chemoradiation plus gemcitabine, you can see that there is no clear survival advantage compared with either observation or chemotherapy alone. If you look at possible factors that could affect treatment effect, we noted that the lymph node positivity, but not the margin or tumor differentiation, affected the effect of adjuvant therapy. So for overall toxicity related to treatment, you can see that there is a limited power due to the small number of toxicity. But with advanced meta-analytic techniques, you can rank the studies, rank the treatment in terms of benefit or toxicity to provide some knowledge about how each treatment compared with another in terms of benefit and toxicity. For non-hematologic toxicity and hematologic toxicity, you can see that chemoradiation plus gemcitabine was more toxic than chemo radiation plus 5-uracil in terms of hematologic toxicity. So based on those results, we were able to conclude that chemotherapy with fluorouracil or gemcitabine is the optimum adjuvant treatment for pancreatic cancer and reduces mortality after surgery by about 1/3 compared with observation alone. Chemoradiation plus chemotherapy is less effective in prolonging survival and more toxic than chemotherapy alone. So for the interest of time, I'll skip the third example and then go straight to a quick recap. So to summarize, I would like to provide a few tips for high impact meta-analysis. Again, first is to find important questions. To do that, you have to be familiar with the biology and the debate in the community on that issue. And after you have a good research question, you need to perform a comprehensive systematic review. Then analyze your data with the sound statistics. Then report the results in response to the research question. And I'd like to wrap my talk here. Thank you for your attention. And again, I would like to thank Dr. Miftah for inviting me. And I would be very happy to take questions. Thank you.
Thank you so much, Professor Liao. This is a very delightful presentation. And now we are entering the third session, which is discussion. So this is very surprisingly, we have so many questions for both speakers, and this is very good. And I hope we have still have many times to discuss and answer all of the questions. Okay, I try to group the question according to the speakers. Maybe we should we discuss it maybe like 3 questions at a time for the first speaker, and then for the second speaker, and then maybe we can discuss how about the question. So I already tried to write it down, a few questions. But first of all, maybe I would like to give the question for Dr. Miftahussurur as the first speaker. Let me share the question. Dr. Miftah, this is there's a question from our college, how to construct the right term in PubMed, when to use the and or not. And there are also the question about how many journals for the minimum amount of data for systematic literature review and what are the requirements. Also the recommended source of systematic literature review. And also can the original research result be used as a reference source for the systematic review article? But most of the reference are based on the paid journal and only showing abstract. And can we use this abstract as a reference source? I think that's the first 3 questions. Dr. Muhammad Miftahussurur, maybe.
Okay, thank you very much. I think we can combine Professor Liao also. I'm very appreciative if you also help me to answer the question. Probably, Dr. Yudith, may you show the question?
Okay.
Okay, number 1, probably from the mesh. I think it is depend what you want to find. For example, sometimes we can choose word that the word is the including abbreviation. For example, Helicobacter pylori, probably. Some journal write H. pylori. It's H. pylori, very rare. Okay. So usually we use Helicobacter pylori or H. pylori. So there was. So it means we agree that both of the words is including in there. But sometimes if we want to find a journal or a manuscript that contain both of the topics, for example, Helicobacter pylori and antibiotics, for example, it means we agree that both of the words that the manuscript is content in there will include it, but it means one of them is we agree. But if we want to include the, for example, H. pylori or Helicobacter pylori and antibiotics, not tetracycline, for example. But I think it is sometimes the word that we use for the mesh sometimes is not only for screening sometimes, because not all of what, but minimally it will the most of we want. Okay. Probably Professor Liao, do you have the idea how I mean the easiest concept for to use the mesh? Thank you. Your speaker, I think. The speaker still on.
Oh, okay. Can you hear me?
Yes.
Okay. So I think it's a very important question. You can also try to use for example, you can, of course, it needs some exploration experience. And for example, with the PubMed, when you type in a keyword, there will be a automatic drop-down list showing related terms. Then probably you need to look through all those terms that pop up. And very often, many of them have to be included into your search strategy. And sometimes you need to try to experiment with different strategies. And also, if there are similar meta-analysis conducted before, you can also check their search strategy and use that as a basis for formulating your search strategy. That's probably something that I think is also useful. Thank you.
Okay.
Okay, the second question, we can continue.
Second question, okay. The second question for Dr. Miftah. Let me share the, how many journals?
How many journals? Okay, how many journals?
Yeah,
okay, it's
for the minimum amount of data for
yes.
systematic
I think one of the sentence of Professor Liao in his slide is very important. Sometimes systematic review, sometimes we could not continue to meta-analysis. It is true. Jadi, so that how many is depend what is your field. Sometimes I confuse if I should discuss about it for another field. I mean, For example, I'm writing about, most of my paper is about molecular epidemiology. If we talk about it or some discuss to or try to write or review, although if after selection we only got 20 good journal, I think is enough. But I think for although there was no specific rule, I think more paper is also important. It depends the existing paper, what they say. If they say yes, 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 all the people is agree, I think we don't need to write a review, right? But if it's found some controversial, then the controversial is 20 versus 1. I think we have to find really another find. Although a journal that not included, sometimes we can edit in there, 2 or 3 journal, although it's not included with the note, with underlined sentence that it is actually it's not included. But I think less than 10 or the number is minimum. I think it is a more. It seems more valuable that the editor will decide it. I think like that. Professor Leo, do you have an idea how many actually the minimum paper to include it?
Yeah, I think I totally agree with your view that the more the better, of course. And sometimes for certain novel ideas or very up-to-date research, sometimes you will see meta-analysis that includes only maybe 4 or 5 studies. Sometimes that's also possible and acceptable for good journals, but mostly it's because there is no guideline or generally accepted consensus on that issue. And the importance of that issue is widely recognized. And usually it's a novel, a new condition. So it's pressing to pull all the available evidence to give a quick answer to that problem. Yeah. Thank you.
Okay, thank you, Professor. And the third one, Dr. Miftah, about can the original research result can be used as a reference source for the systemic review article, and also most reference are paid, not open access, and only showing abstract. And can this abstract be used as a reference source?
Okay, thank you. So of course the main source of the review article is original article. So it is have to or original article. However, sometimes we can include it some original article unpublished data sometimes to increase the confidence and I mean give more value to the editor sometimes. Although finally they will say don't put the sentence. Although, but actually sometimes I write first. I already have the preliminary data and blah 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 for to make editor is trust to. Although finally we delete it. Sometimes it is only tricks how to input. But you know, Professor Liao is we are in the different level. Professor Liao with his group already published in very high impact factor journal. You can check gastroenterology, maybe Lancet, I think, Professor Liao. I checked your publication. So I think his suggestion is very important.
Okay. How about your opinion, Professor Liao? How about, can the actually abstract can be used as a reference source? Because there's, in Indonesia, I think there's so many, not an open access journal here.
Yeah, I think there are two scenarios here. The first is that if a paper has been published in full text, then if you decide, of course, you can use the abstract to decide whether it's likely to be eligible or not when you screen for the studies. However, I would suggest that when you decide to use the study in your meta-analysis, then you should carefully look at the full manuscript. Because if you only rely on the information in the abstract, sometimes you will miss important information. On the other hand, some studies are published only as abstracts. That is another issue. Then in that case, you can decide whether you want to include only papers that have been published as full paper, or you can also decide to include also studies that were published only in abstracts. But usually that is not very common. Sometimes if there are not many studies on that issue that have been published in as full papers, then probably you will want to include studies that are published in abstracts only. Thank you.
Yes.
Okay.
I think I also agree, Dr. Yudith, that very uncommon, I think, put only abstract criteria. Yeah. Very uncommon. However, sometimes, as Professor Liao said, sometimes, although we didn't include in the main of the paper, sometimes in the discussion, we say something about this paper, sometimes.
Okay, very well. The next three questions actually are directed to Professor Liao. Let me share the question first. Okay, this is very interesting because our audience is not only from the medical or scientific background, but also from the social economics too. I think this is the question that actually, what are the specific criteria to choose the selected paper for our meta-analysis, and also is it possible to the social economic studies to conduct the meta-analysis? And also there's also, another question, same with the first question, that is what are the criteria to exclude papers that we found during the literature searching? So maybe this one can both be answered, which one can be used or which one have to be excluded, and how to decide and calculate the effect size from the gathering the various studies. Okay, Professor Liao, you may answer the question.
Sure, I'll try to answer the first and the second questions first.
Okay.
I think I am not an expert in social economic studies, so I probably cannot firmly say with confidence whether meta-analysis can be done in that field. But I guess probably the methodology applies to every field when you try to review all available evidence, synthesize them to either point out the future direction for study or try to give some guidance. I think probably these principles are useful across all study fields. Then come back to medicine. I think that probably it depends on your initial research question. For example, if you are comparing two different drugs, two different treatments, then in that case, we know randomized control trial is the best evidence. So in that case, if there are enough randomized control trials available for analysis, then my recommendation is that you restrict your meta-analysis to RCTs only. And thus, you should exclude studies that are not randomized controlled. On the other hand, if there are not enough RCTs to do a meaningful meta-analysis, then probably you need to broaden your scope and consider including non-randomized trials or even observational studies. So in that case, then you need to include them. But at the same time, when you do analysis, it's important to pull those studies separately, in addition to combining them all together. In other words, in addition to pulling all the studies, regardless of the design, you need to pull studies of RCTs and pull studies using non-randomized designs and pull observational studies to show the pooled effects from each design. So I think there is probably no one answer to answer that question. It depends on the research question and the type of design that is frequently used in studies answering that question. And how many studies do you have to conduct your meta-analysis? So that's probably I can think of at the moment. So I would be very keen to know Dr. Miftah's suggestions and advice on this issue. Thank you.
Okay, so based on Professor Liao said that this is depending on how our research question first. So what do you think, Dr. Miftah, about the question that how many what is the most important thing from the criteria to exclude the papers that, you know, this is maybe when we choose something, this is very easy because we want so many things, but but when we want to choose,
you can become researcher or political actually.
Yeah.
You can political, you can choose some criteria what you want. However, actually I think it is difficult. And why systematic review have to, I think this is my opinion, have to write by an author who write minimally 3 paper, original article paper in this field. Why? It is very important because the depth of the knowledge to decide what is the keywords, what is the inclusion criteria, exclusion criteria is very important. But however, if you want, I think if you want to, why in the one of the slide Professor Liao also said, please also check previous systematic review, previous meta-analysis, check what their keywords, what is their inclusion exclusion criteria. We can understand, and sometimes we can get some of the other view than what our view. Sometimes it's very important. Thank you.
Okay. And how about the other question about, is there any, possible that the background like social economic studies to conduct the meta-analysis also?
What I want to say in my first summary is the main idea, the main strategy, I think is same. Probably what the I also part agree also with the Professor Liao that some social review, they have different rules about the length, about the structure of the review. They also different, but how to write, I think is same. How to write, I mean, for example, the general rule, for example, do not put the figure from other paper, the table, please make a citation in each note, each sentence, or something. I think mostly same, but of course, any journal have any specific rule. But
Okay.
I think this strategy you can use to another.
So this is an open opportunity also. Okay. So Professor Liao, the third question, how to decide and calculate the effect size from the gathered various studies before? How about that question?
Thank you. I'm not very sure about the question.
Okay, so maybe before you said about the on your lecture, you said about the effect size and how to decide and how to in the meta-analysis.
I'm not sure if the question is about whether you can estimate the effect size and the sample size. If that is the question, I think it's not like in randomized control trials where you have to estimate the possible effect size and then generate an estimation of the sample size. But in meta-analysis, it's about you collect all the available evidence that has been published. And then you use the accepted methodologies to pull the studies together. And then you will see how much the effect size is. So in that case, the data speaks for itself. So I think it's a little bit different from what you usually do for clinical trials.
Oh, yeah. That's right.
So I hope I have answered that question.
May I ask a question to Professor Liao? Professor Liao, I'm very interesting with your statement that sometimes we can include some non-RCT. If our studies, I mean the studies that we include is very minimal. So some tools, for example, that Cochrane methods show that for non-RCT you can use Robin's eye tool to measure the effect of that is it any bias in the risk of the bias of the non-RCT. How you think, if for example we include it and then we also use some software or some other rules to increase the non-RCT? Thank you very much.
Okay, thank you. I think it's a very good question. For RCTs, we know we have the Cochrane risk of bias tool. And for other studies, other designs, studies with other designs, for example, with observational studies, then we have the Newcastle Ottawa tool for assessing the study quality. So different study designs have different methods to assess the study quality. And the things that they look are different. So I think for each kind of study design, then you should look for the generally accepted ways to assess the study quality with each study design. And as to whether you can include non-randomized control trials in your meta-analysis, I think I have touched a little bit on that issue. Sometimes, and I would like to speak a little bit about this. Sometimes, for certain questions, it's very difficult to do a randomized control trial. For example, in the field of Helicobacter pylori, that in which Dr. Miftah is an expert, it's not very easy to conduct a randomized control trial comparing eradication versus non-eradication for, say, prevention of gastric cancer. So in that case, if you only include randomized control trial, then you will miss a lot of information that has been generated from many observational studies. Mm-hmm. So in that case, if you don't look at those observational studies, it's very likely that you will miss a big chunk of available evidence. So that's also one occasion that I think including observational studies is important. But again, as I just mentioned, it's important to analyze them separately and critically assess whether the benefit observed is different in randomized trials and observational studies, and then carefully interpret those results to inform better clinical care. Thank you.
Okay. Are you satisfied, Dr. Miftah? Okay. So this is a very interesting because we still have so many questions and we still have like 1 more hour to discuss about another question. So the next 3 question is for Dr. Miftahussurur. Let me share you the question. Okay, so in here we have 3 questions. First one is from Mr. Alfian. To make an article review, is it necessary to use a review manager application? Maybe this is there are so many applications, I think. And the second one is from Dr. Prema Makassar, how to register a protocol to make a systematic review, or if you want to use an existing protocol, how do you do it? And the third one is how to focus on search strategy from search engine. Is there any sequence or rule or writing keyword to get the right and focus finding? Okay. The first one, maybe, Dr. Miftah, is there any manager application for the review?
Yes, thank you very much. If many number of the paper, I think it is, you can write, it is true that you can write manually, but some of the software you can help you very well. For example, sometimes I use EndNote and to include it in the same folder, and also, but recently some review software really help you. But probably I'm a conventional person. I'm usually mix between with my note and also EndNote usually. Probably that later Professor Liao also explained to us. And for how registered, this is a very nice question. Usually we can register with the many requirement, some requirement, not many, some requirement, and then I think we can come back to the basic question: why? Why to register? Is it important to register? I try to check that recently, although in Medline, every year is 2,500 review a year. So if you can count annually, it will increase and increase. But probably some duplication, excessive duplication, we can prevent with this register. And although not all the people use this register, but it will helpful for us if your review or meta-analysis is truly important. For example, the group that Professor Wu, I don't know, Professor Liao included or not. I remember that Professor Wu went to write meta-analysis and systematic review about antibiotic resistance in Asia continent. When he write, actually, we already know the title and the theme 3 years before, although 3 years. And then after that, that I check in the gut with the very high impact factor included. So I think it is also important. However, what is the previously, I mean, what is actually need? Some of you can check in PubMed, some journal mention it, how to register, why, what kind, they included. For example, research question, patient and population, intervention, exposure, comparison, outcomes, how such strategy, criteria for inclusion, exclusion, participant, methods of analysis, anticipated that date, and so on, so on. Many things, almost more than 20 items, I think. So maybe if you think it is complicated, I think probably, but it is very important. Professor Liao, maybe he has another experience. And the last question about how to write keywords. I think this I must say, without knowledge of the field, you never write the good keywords. But I don't want to make you give up. How to do? Just remember the rules and, or, and not. This is the rule, okay? Then please write in the PubMed. If you can find good number for review, good number is more than 2,000 is impossible, I think. But if some group can do, some group, but for me, I don't have enough time. But probably 500 is a good number for me. 500 is a good number. So if we can detect it, very good number, 500, then after that, try to put this, recheck again. What the previous result, any controversy, any something, so you can continue. So don't give up, although probably the first time you cannot include in the very good journal like Professor Liao journal, probably you can try only Scopus Q4. Do not worry. We can continue. Do not worry. It is your first experience. It is also when I do first experience, what my senses say is very good, very nice. No worry. This is only his sentence. Although I know he checked well about this paper, but it is very important. Give me the spirit, give me the power to do my first review paper. Thank you. Your question, your voice, Dr. Yudith.
Okay. Professor Dr. Miftah, thank you very much. And for Professor Liao, because you are already become the expert of this meta-analysis, and how about from your point of view about this review manager application, is there any maybe like protocol or maybe some basic application that you teach your student in Taiwan?
Okay, I think to begin with, I think there are some built-in functions within the PubMed system. So they are free and you take good use of them. It should be very useful. And then secondly, I agree that EndNote is very useful. Almost, I think, it's a must-have. And if you have these, the EndNotes and the PubMed functions, probably in most of the cases, it's probably enough to efficiently conduct your meta-analysis. And if you want to use something that is dedicated to this task, I think it's also okay, but probably that's more advanced and probably costs some money. As to protocol registration, I think it's not required for meta-analysis yet. So there are a lot of debates on whether it's necessary, whether you should do it or not. I want to put it simple. I would say that before you do your meta-analysis, I think it's worthwhile to check the registries to make sure that nobody has ever done something very similar as what you are going to do. If someone has already done this or are doing this for some time, then probably you should consider choosing another topic. So but on the other hand, sometimes it's possible that someone is doing the same thing as you do, but they have not registered. So in that case, there's no way you can know that. But if your idea is very unique and very refined, probably there's a good chance that your meta-analysis is novel. Thank you.
Okay, thank you very much. Before we move to the next three questions, both of our speakers very popular here, so and they are very knowing that the material of the lecture is very useful. And I would like to ask for both speakers, would you like to share your presentation with our audience? So maybe if you don't mind, we can ask for your material of presentation and then we send it to the participant. Is it okay for Professor Liao?
Yeah, I think it's a good idea, but I will review my slides and then I will send you a copy to make sure that no any copyright issue in the slides. And then I share it with the audience. I would be very glad to do that.
Okay, thank you very much. And Dr. Miftah, would you like to also share it?
Okay, no problem.
Okay. So for all the audience, that is a very good news. And from your registration link, maybe after we receive the updated presentation from both of our speakers, we will send to all of you. And the next question, the three next question for Professor Liao. And let me share the question first. Okay. Already appear on your screen, Professor. So there's three more questions. The first one, in an intervention-based systematic review, how to limit our research topic. Maybe this already been discussed, but is it better to compare more than one intervention techniques, or we just focus on to describe at one intervention technique on our topic? And the second one, how to write a simple review. Maybe this is about a simple review or mini review to deeply answer the need of extraction so many papers that not explain anything here. And the third one is how to get research writing so that the research, it reached a stage that it is interesting to read and can become a reference to other writers in index journal, even though the writing was originally in the category of ordinary writing. Okay, maybe the first one, is it better to compare more than one intervention technique, or we just focus to describe one intervention technique? For Professor Liao?
A very good question. I think probably there's no simple one answer for that question. It depends on your research question and the available treatments for that certain condition or disease. But as a general rule, I would say that if you can include all available treatments, probably your meta-analysis would be more valuable. If you, say, have 5 existing treatments for a certain disease, and you compare only 3 of them, then we don't know how the other treatments should be compared with the 3 you are comparing. So I think unless the treatments are drastically different, or for example, if you have 3 different medical treatments and 2 surgical treatments for a certain condition, but the medical treatments and the surgical treatments are for patients at extreme ends of the disease spectrum, then probably you don't have to compare medical treatment and the surgical treatments at the same time. Otherwise, in most of the situations, I think it's better to include all available treatments in your meta-analysis. Thank you.
Okay, thank you very much. And for the second question, Professor, how to write a simple review or maybe a mini review to deeply answer the need from extracting so many papers that not still haven't explained anything perfectly yet?
I think I'm not sure if I fully grasp the question, but I would say that probably there are 2 different kinds of review. One is a literature review, a narrative one. For such reviews, I think you can decide what studies you want to include in this review. And you can exercise your opinion. If you are an expert in this field, then you can exercise your judgment as to what studies you want to include in your review and what studies, for certain reasons, you do not want to include. And then you can elaborate your personal opinion in that review. So it's kind of a mixture between standing in the middle of a meta-analysis and expert opinion. And another kind of review is a systematic review, which we are talking about today. In that systematic review, it's different. You have to include all available evidence as much as possible, all that is relevant to this field, to that research question, and objectively review and summarize the available evidence. So a further meta-analysis is to do a quantitative synthesis of the research that you have covered in the systematic review. I hope I have answered this question. So, and later I will be very happy to know if, I think probably Dr. Miftah can answer this question.
Okay. I think it's very clear, but maybe the one who brought out about the mini review words is actually Dr. Miftah. So what do you think, Dr. Miftah? What is also the difference between the original systematic review and the mini review itself, and how actually what can we have or what can we grasp from this mini review, and how to make something deeply from so many journals that can be delivered by this mini review? You can answer. Dr. Miftah, your voice is already haven't been unmuted.
Thank you, thank you. So what I share my idea in the PowerPoint is ideally, okay? This is the ideal. But actually, I want to tell the truth. Sometimes I want to write very interesting paper, interesting theme, I mean. Interesting title, it is very interesting. But actually, I don't have idea what I have to write. What is the conclusion? What is the track? Actually, I don't know. But I want to write sometimes. Because because I have I think it is my the sentence that I believe the sentence that if I write, I will learn. So sometimes I'm right, although I'm never read before about this term. I write. Oh, then I understand. Okay. So sometimes I just put the paper. Okay, the paper is 500. I don't have idea. Then I just read one paper. I just put until finish. Then after that, I just rethinking in with several days or several weeks. Actually, where is my position? I believe with them or with the others. Sometimes I do actually. So do not worry if you don't have idea. Although and Professor Liao said, ideally from beginning you have idea, you have the focus for your idea, and then establish in that way sometimes. But you have a risk if you to do what I told you previously, that just right, you have a risk that you have to do many work. After that way, you have to change your way, change the way. But it is only can do in review paper, I think, or only in systematic review. But meta-analysis, no. Meta-analysis, I think, is we cannot do like that, because it makes all starting from beginning. About the mini review, what is the different mini review and and review, for example? Number one is the length. The length is the different. 3,000. Some maybe mini review is less than 3,000, less than 2,500. Full review 5,000, for example. But you have to know what the aim of both of these is different. Mini review used for busy people, busy research, busy lecturer, busy scientist. If I don't want to read the long manuscript, so if you want to write mini review, you cannot write many detail. General sentence, so all make simple in 2,500 words. But if you want to write very detailed, and maybe some lecturer have a not so busy time to read all the thing, maybe sometimes check detail, it is true or not. Maybe it's a review paper. It depends the goals actually, but I don't know. I write mini review 2 times, but I actually I am not truly like it. So usually I'm writing the full review, right? Full review, because I can write all of my idea in there without any limitation about the words, about sentence or others. Thank you.
Okay, that is a complete answer from both of our speaker. And the third question, Professor Liao. So there's a question that how we actually can do a research writing, I mean to produce a writing that it can reach a stage that is really interesting to read and can be used as a reference for other writers, even though the reference or the journals or the source of the original writing comes from the category of ordinary writing. I mean, is it possible, or the class of this ordinary writing, even if that is come maybe from the lowest or the lowest Scopus index or impact low impact factor, can be still become at the end we can how to make the writing become very interesting to read and can be used as also a good reference. I think that's the question for Professor Liao.
Okay, so I guess the question is how to make your article useful and interesting to the readers, even if they finally end up being accepted in a journal with a decent impact factor, not a very high impact factor. Is that right? So I think impact factor is not.
Excuse me?
Can you hear me?
Professor. Yes, yes. Okay.
So I think impact factor is not everything. Sometimes very excellent work could end up being rejected by good journals, I mean high impact journals in the first place, and later found to be world-class research rejected at the first place. A very good example is the discovery of Helicobacter pylori. When Dr. Marshall first sent his manuscript to the Lancet, he was rejected. No, not the Lancet. I think it's the Australian Journal of Gastroenterology. And he was rejected. And everyone knows that this turned out to be a Nobel Prize winning research. So I think what makes your work important is whether the research question you ask is important, whether your methodology is sound, and whether your results are convincing, are robust. And if all the answers are yes, then I think you have done a good research. Then it is a very good chance that your work will be accepted in a good journal and become useful and interesting to a wide audience. And in that case, such studies, of course, has a good chance of getting funding from funding bodies. So I think I've provided a useful answer for this question. So I would be very interested in knowing Dr. Miftah's opinion on this good question. Thank you.
Okay, before we goes to Dr. Miftah, Professor. So there's a question that there's a connection here of the question is from Mr. Heri Suroto that should we do critical appraisal before we include the paper to the become the meta-analysis? I mean, one of those sources. How about the question, Professor? So let me repeat the question. So regarding continuing about your answer from the previous question, there's also a question from Mr. Heri Suroto here that I think have connection with the previous question. He asked that should we do a critical appraisal before we include the paper that we select to become one of our a source of our paper of meta-analysis? What do you think about should we do a critical appraisal, or just we know that this paper is the same, or can be conclude in our topic, or we have some levels of the paper that should or should not we include them as one of our sources? How about that, Professor? Professor Liao, did you? Yeah, I'm sorry. I'm asking the question to you previously. Yeah. Okay.
I think, I think it's important to assess the eligibility of the studies based on whether they are relevant to your research question in the meta-analysis. So it's important to judge their eligibility based on whether the study population, the patient population is relevant, whether the study design of the study meets your inclusion criteria, and whether the information that is needed for you in your meta-analysis was reported in that study. And if there is any methodological issues in the study that you are assessing, and also whether the outcome reported are what you need. I think that's the most important thing is you base your decision for whether to include the study. And if the study meets all the requirements for you to include it, then you have to include it. Even if the results look seem different to your personal belief. On the other hand, if the study has issues that makes it not qualified for including into the meta-analysis, then you still have to exclude it, even though that is the result of that study is, for example, similar with your personal opinion. That's my idea about this question. Thank you.
Okay, thank you. For the next question is for Dr. Miftahussurur. So we have collect the next 3 or actually 4 questions. I will share the question first. Okay. Already appear on your screen, Dr. Miftah? Okay, yes. So the first one, I think this is already a little bit similar with the previous question from Dr. Prema in Makassar, that regarding the protocol, that is it necessary to publish our review protocol when we are conducting the systematic review, because Prospero do not accept the protocol for scoping review. And then there's also a question that this is very interesting. This is the basic knowledge that I also get from Dr. Miftahussurur about the subtitles. This is a very big no for for you. Why is the use of subtitles really not recommended in the writing reviews? Doesn't that help the structure of the article, make it easier to understand? And the third one is there any difference between the review article and a thesis with a literature review? So we are talking about the thesis with a literature review. And there's also a message and a question that is have a connection with the Airlangga University. So one of the issue in writing review article is to access to the papers that need to be reviewed. And will the University of Airlangga extend the access of subscription to most of the journal like Science Direct, SCS, RCS, and many others? Okay,
Yes.
I think that's
Thank
the
you.
question first.
Probably it is the last question because I think it is enough. It's not enough time for Professor Liao, especially. Okay, number one. I think number one I do need to answer because most of it is already discussed. For the second, I think not subtitle, but subsection. If about subtitle, if you want to write subtitle, okay, but you have to mention about the length of the title. The length of title is usually only in 12 words, 10 until 12 words. So you have to remember about it. But why we please do not use the subsection? It make all of the audience will, I think, not focus to what we say. It will make the difference between review article and the book. Do you remember? If the book, you can write as you want with the chapter, sub-chapter on something. But review paper usually is not about sharing knowledge with the continuously like in the books. But we want to write any sections that already connecting in each of the section, and then we want to say what our opinion, what is our suggestion, what is our belief with all the summarized. So as like the question to Professor Liao that sometimes how about if we have to check first the journal, it is true, the journal is the population, blah, 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 it is true. But I suggest you, because you have already have the rule, what is the inclusion criteria and what is the exclusion criteria, you have to not obey the rules. Please put all first. Then in the discussion of the paper, you can say, or in the result section, you can say that the paper number 7 actually personalized, you can say, have a lot of weakness. You can say, because you have the rules. What the rule, except to not included a paper, you edit another rules. So everything will fair with this way. And also, what is the next question, Professor Dr. Judith?
Okay, for the next question is there any difference between the review article and the thesis with
yes, different, very different. That's what I say in my slide is the importance is what is our suggestion, what is our opinion, what is the which way you will put the readers go to somewhere. Actually, it seems with the opinion, but more objective opinion in the newspaper. You make persuasion, but you have the data. This is the data. This is the result. This is the analysis. So in the discussion, you make persuasion to the readers. It's the same. So I think the difference is that I say in the do not use subsection. Then give your idea, give your suggestion, or so on. Yes. Thank you.
Okay, and I think the next and maybe the last question for you. Will University of Airlangga extend the access of
Yes, of course,
subscription to most of the journal?
I think, of course. Of course.
Okay, of course. Okay, ladies and gentlemen, I think we really have a big joy here that lots of participants is very active and very enthusiastic to ask our two speakers here. But unfortunately, I'm afraid the time for us is almost finished. And before that, we would like to apologize for all the audience that the question that is not being selected to be discussed yet, but I think next time and maybe we have another meeting, but and in the very short time we will collect the updated material of presentation and all the email that already been registered to us, we can send the material. And once again, we would like to say our gratitude to both of our distinguished speakers, Professor Liao of Taiwan University. Thank you so much for your coming here and for your time and enriching the knowledge of Indonesian academic community. And we hope in the next or in the future we can do more activity like this, and we can proceed to another collaboration of research and also writing. And also we would like to say gratitude to Dr. Muhammad Miftahussurur. Thank you so much for your time, and also to give your many experience and your knowledge also to Indonesian community of academia. And ladies and gentlemen, I hope you found this afternoon presentation and meeting has informative and useful enrichment for your knowledge. Thank you so much for spending your time with us today, and maybe in a short time we will see you again. Thank you. Good day. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Professor Liao.
Thank you very much.
Thank you.
Thank you, Dr. Miftahussurur.